November is Lung Cancer Awareness Month. And experts say 1 in 16 people in the U.S. are diagnosed with this disease each year. 10 on your side's Ashley Knight has a look at a simple procedure that is detecting it earlier and saving lives. Ashley?
Well, Tom, lung cancer is the leading cause of cancer deaths in America. Catching it early is vital. That's exactly what a low-dose CT scan does, but only 1 in 10 people at higher risk take advantage of the procedure. Frank McKenna was first diagnosed with lung cancer in 2016.
I had a hacky little cough that I went to the doctor for. They thought it was some kind of, allergies or something.
When medication didn't work, they did a scan and found fluid in his lungs containing cancer cells. It was already at stage 4. His 5-year survival rate was 4%.
I knew that the statistics and outlook was grim, but, it was just a fight, another fight to take up.
McKenna's story is a common one, but folks at Sentara are trying to make it scarcer. They're getting the word out about low-dose CT scans, a procedure offering a low dose of radiation, making it safer for long-term screening.
The lungs are well visualized on a CT scan, far better than you can see on a chest x-ray. You can see nodules down to probably 2 millimeters or so.
Most patients aren't diagnosed with lung cancer until they see symptoms, but by then the cancer is usually at stage 3 or 4.
80% of the patients are going to have disease beyond the small localized area. But we know that if we can catch it at that area, the 5-year survival rate is almost 60%.
Low-dose CT scans can detect lung cancer as early as stage 1 or 2, which can make all the difference.
Catching it early really makes a huge difference. Not only minimizes what you require to treat it, absence of not needing chemotherapy, for example, makes it much more treatable and much more curable.
Before, a majority of lung cancers had a survival rate of under 50% for any stage.
I would say now that we're seeing in excess of 50–60% for stage 1s and getting better, even 70% for some of these early stage 1s, which is significantly better than even stage 2, 3.
It's a simple test that takes about 2 minutes, but those eligible aren't taking advantage of it. It's an annual scan recommended for those with a long history of smoking as well as other criteria. Frank McKenna, however, is not a smoker. A genetic mutation made him predisposed to the disease, but he urges everyone eligible to get checked out.
Low-dose screening is so important because if you catch the lung cancer at a stage 1 or even 2 or 3, you have so many more options, including surgery, which I didn't have at the time.
McKenna understands the anxiety that comes with a diagnosis. A former personal trainer, he's dedicating himself to helping others improve their bodies and their minds.
Instead of being defeatist and saying, I can't, I want people to say, okay, I have cancer now, I can, or I will, and do the things that are going to help you through your journey and not feel like the journey is beating you, but taking the journey on head on.
And Frank is now a certified cancer exercise specialist, holding workout programs at Sentara Brock Cancer Center. Find out if you're qualified for a scan by visiting wavy.com. There you can also find information on Medicare coverage and where you can get the scan locally. Ashley Knight, and on your side.